Hello, everyone, and welcome to the Babies in Common Show. I'm Jeanette.
And I'm Melissa. Welcome, listeners. As a reminder, any information shared during this show is not to be taken as medical advice. Please consult your own care providers for questions about you or your baby's health and visit babiesincommon.com/disclaimer to read more.
All right, today is Friday, November 13th, 2020, and today we'll be talking about the words we choose and why they matter in the context of infant feeding and parenting. Our guest today is my dear, dear friend, Renee Beebe, who is an international board-certified lactation consultant in private practice in Seattle, Washington. She's been a lactation consultant for more than 20 years, doing home visits and working in a naturopathic physician's office, where she sees families and assists with frenotomies. She's the proud mother of two beautiful grown women, and in her spare time, she loves to garden, play violin, and hike in the nearby mountains. You can learn more about Renee and her practice, and she's an excellent blog as well, at second9months.com, and the 9 is not spelled out. It's the numeral 9, second9months.com. Well, thanks for coming and joining us today, Renee.
You're welcome. Thank you.
So great to meet you, Renee. And I love your website because, we talk about the fourth trimester and the second 9 months. For me, though, it's like the second 9 plus 9 plus 9 months when it comes to breastfeeding. So that's another topic. But I love what we're talking about today. Words. I think it's so important to think about how words impact us in life. And because this is the Babies in Common show, of course, today we'll be talking specifically about words related to feeding and parenting of, babies, of course.
Yes. And in addition, Renee, to being a lactation consultant, you also have a master's degree in education, and you served for 10 years as a special ed teacher, researcher, and administrator. So I imagine that also has influenced your tendency to choose your words very carefully.
Yes, totally. And it also helps me understand normal child development. My first placement actually, when I was seeking my teaching degree, was in infant classroom. And so that just opened my eyes, taught me a lot.
Awesome. All right, so let's start off as we talk about feeding. We'll start off with a classic as the thing that happens. One of the first things that people talk about happening is the quote unquote milk coming in. So, Renee, what does that term mean in the context of human lactation, and what is a better term to use and why?
Oh gosh, yes. I hear this all the time. People are talking about, oh, my baby is 6 months old and my milk still hasn't come in yet.
Oh gosh.
And
wow.
What they don't understand is what they're talking about is they're not seeing the volume that they would like to have. But generally what that term means is that there's a transition that happens from colostrum, which is being made since you're about 20 weeks in pregnancy. And then after you give birth to the placenta triggers your body to start making mature milk, which is the milk that we think of as real milk or the milk coming in. And it is kind of a gradual process, but gradual meaning maybe 2 or 3 days you start seeing that. So it can seem like it's happening all at once. So that's what it actually is. It's a transition from that first milk to the mature milk that's going to feed your baby for the rest of your breastfeeding time.
And then it still continues to increase in volume for like 8 to 12 weeks generally.
Sure.
Science shows us. Some people can increase it after that too, but yeah, it's a slow process that happens. But for some people, it's very quick. And I've seen people, as I'm sure we all have, where they're like 5 days postpartum and they have so much milk.
Mm-hmm.
So it goes back to the old adage that my father taught me very well from the time I was small, is that life is not fair.
Yeah.
Well, and I think it can seem like it happens all at once, particularly, let's say your baby isn't nursing really well, maybe isn't doing a good job of helping that milk be removed in the first couple of days. And then it seems like, whoa, all of a sudden everything is different. Or maybe if you've had an IV of fluids, it can increase that engorgement. So there's all kinds of things, but generally, it's if you're breastfeeding well, pumping frequently, it's kind of gradual.
And I think what's as a former maternity nurse working, labor and delivery and postpartum, I think the biggest issue in the beginning for a lot of people is this idea that if the milk is going to come in, quote unquote, that there isn't
Right.
any milk there now, or that
Right.
colostrum isn't
Right.
milk. And there are certain cultures around the world that actually, culturally discourage the feeding of colostrum, to pump or express the colostrum. And because colostrum is rich in gold and yellow color, it doesn't, quote, look like, quote, milk as we think of this milky white milk substance. It's sticky and concentrated. It's full of antibodies and so many delicious nutrients for the baby whose belly is only the size of a cherry when they're born. And so they really can't handle the volume of mature milk. But a lot of cultures, they discourage the feeding of that, saying it's bad milk or it's witch's milk or it's tainted milk and somehow. And that can really kind of shoot you in the foot if you're not, stimulating your breasts or putting the baby to the breast during that time. Can you talk a little bit about why that practice can kind of hurt your breastfeeding success?
Oh, totally. And I also want to add about that whole point that you made about if you're talking about the milk coming in, that means it wasn't there. I see so many people say, well, I didn't have any milk yet. So of course I had to give my baby a bottle of formula.
Right.
So just not understanding that piece of it can really change how breastfeeding goes. And so, yeah, what was your question? Your question was about how does that change things?
Yeah, if people don't put the baby to breast during colostrum, choose to give the baby bottles of
Mhm.
formula for the first 3 days because they, quote, don't have any milk. And I hear this a lot, like I said, especially from certain
Right,
cultures. How can that affect your
totally.
breastfeeding relationship or success in making milk?
Well, so many things. First of all, you're not going to feel as confident about breastfeeding going forward because obviously there must be something wrong with your body if you can't breastfeed in those first couple of days because people are telling you that it's not right to do that. Secondly, if the milk isn't being removed consistently, it can sort of impact how quickly that milk does, quote, come in. The baby helps place the order for that
That's a
milk.
great phrase.
Yeah, so we know that the more often milk removal is happening in those first 2 days, not only the faster does the milk increase, but also long term, it's going to help you make more milk over the course of your breastfeeding relationship. So it can really have a big impact.
It's supply and demand in the very simplest of senses. For most people, it's supply and
Mm-hmm.
demand. So I love that you guys are using the term first milk and mature milk. I think that any professionals, doulas, whatnot that might be listening, I encourage you to use that term, nurses, because like we've said, colostrum, while that might be the medical terminology, makes it sound like it's something other than milk, but it's really just
Right.
your body's first milk. Your body is very smart.
Yeah, some people
So
call it early milk.
sure,
Mm-hmm.
early milk, first
I like
milk,
first.
definitely.
That's a nice word.
I like that. When I see somebody, when I'm lucky enough to see somebody really early before the milk fully transitions, they're saying, "See, this isn't milk," and I just keep calling it milk. They're like, "Look at that milk you have," or even when
Right.
they're pregnant, and I'm teaching hand expression when somebody
Yeah.
is pregnant. Look at all that milk you got out. Is that milk? Yes, it's milk. It's your golden, wonderful early milk. So yeah, definitely call it that. I think that's really important.
I
And then
agree.
moving from there, there's also a lot of talk, especially on the internet, and it goes in waves that we hear things talked about. It's so funny that people are like, oh, well, what about the foremilk and the hind milk? I have to
Oh,
keep the
yes.
baby on the breast for 15
Oh.
minutes on each side, or someone told me 20 minutes on each side because I have to make sure he gets the hind milk. And so, how do you respond to that and those terms?
Well, first of all, my blood pressure goes up
Yeah.
just a little bit when
Deep
I
breath,
hear
deep
that.
breath.
It just concerns me that we are sending people away from watching their baby and instead watching a clock. And this is not helpful at all. And people are thinking, well, there's a certain amount of time I have to spend on each side. And I see babies really getting tired and there's a whole nother breast over there waiting, and these babies get tired and maybe they're not gaining well because they're sucking way beyond when swallows are occurring. And all we need to do to solve that problem is offer the baby the other side. One thing I talk to parents about, because every single person I see is very worried about that, is that, if you move the baby over too early, so let's say the milk isn't quite done on the left side, but you move the baby over to the right, it's okay. That milk is still, if you need to go back to the left side, it's still going to be there.
Yeah.
And they always look at me in shock and say, you mean I can do more than two sides?
Right.
So
I suggest that so often now. I'm like, do 3, 4, 5 if you want to. Like, if that baby's falling asleep, put them on the other side until they, they're like so sleepy because they've had such a good feeding. And of course we're going to evaluate whether that really was a good feeding,
Sure.
if baby's growing and pooping, etc. But it's mind-blowing to a lot of people because I think parents are being told so early or on the internet or who knows, this like 20 minutes each side or 15 minutes per side, which is not based in any evidence. And so, plus you have 2 breasts, so you think I did one and then I did the other and I'm done.
Right.
It's not quite the way it works.
Yeah, totally. And people are, I think they're just really worried. Like they have this idea too, and they're being told by a lot of people that there must be something wrong with their hind milk, or they don't have enough hind milk, and that's why their baby isn't gaining weight. Instead of, no, we just need more milk. Just,
Right.
Any kind of milk. We like that, just give your baby your milk. It is perfect. And we have very little fat in our milk as a species. We're mostly carbohydrates, and that's how babies grow. So, and then I think it helps people relax.
Mm-hmm.
Yeah, definitely. I mean, my normal everyday 5 o'clock in the evening to 9 o'clock at night for all 3 of my babies in the first 6 months of their life was just going back and forth on my breast. I'm going to be honest. So if you feel like all you're doing is sitting on the couch watching Netflix and putting your baby from breast to breast, you're probably doing it right.
Yeah.
I mean, babies, as we've talked about in other episodes, we think of breastfeeding as infant feeding, and it is.
Right.
It is a way to get nutrition into a baby for sure, but it's also very much about parenting too. Like breastfeeding is also a way to parent, and it's not to say that you can't parent without breastfeeding,
Right.
but my baby, sometimes I'd have to switch him back and forth to keep him awake. Sometimes I have to switch him back and forth because he slept really well that night by some unusual thing, and my breasts were more full that morning, and I needed to take a little bit off each side,
Right.
1 to 1 to 1, so I felt like I didn't explode. So it just, it is what it is. It's yes, back and forth is going to be pretty normal for a lot of breastfeeding relationships.
I tell you, I wish I knew all this stuff when I had my little ones, for sure. Things would have been
I think
different.
that this 20-minute idea, because I hear a lot of nurses say this, comes from, a lot of times in those first few days in the hospital, when someone's just had their first baby, they've never breastfed before, they don't have a lot of breastfeeding education, those babies can be pretty sleepy. And maybe we can talk about, we'll talk about that later, but they can be pretty sleepy. And so they maybe quote nurse or suckle for a couple minutes and then they fall asleep, quote unquote.
Right.
And the parent, the nurse sees them latch, leaves the room, comes back 3 hours later to give some medication. They're like, how long the baby nursed for? And the parent says, oh, he fell asleep after a minute or 2. And you're like,
Yes.
no, you should have called me back so I could have helped you get him on. Now he hasn't nursed in 9 hours,
Right.
So they just think, oh, he doesn't want it, and so I think that a lot of nurses, just because of the pressures of the hospital, kind of give parents this idea of you needs to be at least 15 minutes, because if it's not, call me so I can assess. And what parents hear is 15 minutes on each side and then I'm done. And so, we have to find a better way, I think, as nurses to communicate what we mean, which is we want babies to be suckling on cue early and often, and if the baby is, quote, too sleepy, please call for help so we can help you get that baby latched on. Because sometimes if we can get a better latch and the baby has some reward for all of that work, they're like, oh, now they're suddenly interested.
But also that time frame in the hospital is very different than 2 or 3 or 4 weeks later, when your milk has now increased in volume, and in some people's cases they have so much milk that the baby does not need to be on for 15 minutes.
Yes.
Right.
And maybe they only need 1 breast for 5 minutes. I've seen that happen. I'm sure we all have.
Totally.
That happens. And people are like I've done consults where people are like, I don't think my baby's eating long enough. And I got there and the baby's humongous with roly-poly rolls and happy smiling, and nurses for 4.5 minutes. And you're like, yeah, your baby's doing great.
Well, everybody's breasts have a different capacity, right? And it doesn't necessarily correlate to size. Some people think, if I have smaller breasts, I can't breastfeed, or that big breasts automatically mean a lot of capacity, and that's not necessarily true. But so while it doesn't correlate to the size or shape of your breast, the truth is that breasts have different capacity. And so, whereas you can't compare yourself necessarily to another mother or another breastfeeding parent,
Right.
with how long that they, especially in times of the day too. I mean, personally, I would always feel like I had more milk quote in the morning than in the evening. And so, my breasts might have felt fuller during the day than they
And
did
one
later
breast will be
on.
very different than the other.
Yeah,
Right.
exactly.
Right.
So,
Yeah.
And they are both good boobs. They are both doing their best. We don't, I know this is on your list to talk about, but we
Well, we
don't
can talk
have
about it now.
we don't
Yeah,
have
let's
a
talk about
bad
it now.
boob. We don't have bad boobs and good boobs.
Yep.
One of my favorite clients said, "Oh, this is the silver boob." And I'm like, "Oh, you have a silver boob?" And she says, "Yeah, I have a silver boob and a gold boob because it felt really wrong for me to say good boob and bad boob."
Oh, that's sweet.
And I'm like, they're different. I love
Right.
that. We love silver, we love gold. And so that's how she kind of referred to them, to say that they were different. They each produced their own unique amount of milk, and she was going to be happy with both.
They're not slackers. They're not lazy. They're not duds. I like to call it a bonus boob.
Yeah, there you go.
The one that makes less is your bonus boob.
I think that's great. I mean, you've actually personally known, Jeanette, people that have successfully breastfed a baby with only one breast, right? Whether it was
Absolutely.
because the baby only would do one side, or wasn't one of them, she had a mastectomy?
Yes.
I haven't worked with somebody with a mastectomy myself, but I've definitely worked with
have.
one. Yeah, I'm sure, because you've been doing this longer than I have. Yeah, but I remember one person had such an inverted nipple on one side, which she did nurse on for a while, but it became just too much trouble because it was so pulled inward that she made so much with the other one. She was just like, I'm not even going to bother anymore. And she used the one. Yeah, but mastectomy is definitely a one that
or
happens
radiation.
For sure.
I see a lot of people who have had radiation on one breast, and it kills all the cells that make milk. So they do one.
Well, my son named my boobs. He breastfed until he was 3, and he said, "Well, this one's Cutie and this one's Sweetie." And I said, "Oh, awesome."
That's funny. I used to have cats named Sweetie and Cutie. And Darling and Sweetheart, and I gave him a bunch of weird names.
Gosh,
Baby, I think was one. Yep.
He loved them both. I mean, he didn't feel one of them was a slacker. One was Cutie, one was Sweetie. So
I love that.
So, all right. So flow. So let's see. So there's the letdown of the milk.
Oh,
and
yeah.
that expression. And I still find myself saying it, but I really am trying to transition over to saying the release of the milk, not the letdown.
Exactly. Right? And I tell people when they start saying let down, I say, the actual word for this is milk ejection reflex. Isn't that cool? And then they're like, oh, because I think people assume that babies are sucking the milk out of the breast, when really their sucking stimulates us to shoot the milk out into their mouth. And so when they hear milk ejection reflex, then they realize, oh, I have something to do with this. Right. So
any parent of a very curious and nosy 9-month-old knows about the milk ejection reflex. And that baby turns their head and your milk sprays across the room.
There it goes. So I think so many times, and again, this is another word thing where, and it sort of leads us into this other idea of, oh, well, look, my baby is using me as a pacifier, right? So I will talk to them about, really, it's your body has the responsibility of giving the milk to the baby. Your baby is the recipient. Let's see what we can do to help you relax, or whatever that is. Let's use some breast compression. One client I saw yesterday has been pumping for 3 weeks, and she brought out her pump we were doing a flange fitting, and milk started pouring out. She put the baby to the breast, and he wasn't swallowing for a while. And I said, turn on the pump. So she learned how her body had gotten used to letting down or having a milk ejection reflex to the pump. And so she's using that to kind of train her body to have the reflex for her baby. So, I just think it's really cool once they know what it actually is, then they get it, because there's nothing coming down.
Yeah.
Where is it coming from?
I think it's coming from the larger part of the breast down to the
let
nipple is sort of what they're thinking. It's,
yeah, like somehow it's moving down from somewhere.
but even just the expression like, oh, he let me down, or she let me down,
Right.
or
It's a
a
very
child
negative
going, let me
term.
down. That's a negative term. So the idea of release is a nice word to, or flow. Oh, can you feel the milk flowing? Is
or
another
even,
way to put it.
Let's call it let out. If we're gonna let it somewhere.
Yep.
That's true.
Yep. That's
fun.
true. Yep. And then breast milk versus human milk is another nuance. What do you think of that?
I like saying human milk, just because it helps us all understand that we're a mammal,
Right.
or that we are mammals, I should say. Because I think in general, the families that I see are not thinking in terms of the fact that we're mammals and that our babies are mammals. I have a blog post about that I refer people to a lot, and we can't take the mammal out of the baby, that's who they are. And once we see ourselves as part of all of those other animals who are all doing the same thing, I don't know, I think that helps us feel that we can do this too.
That's true. And then I think of not only that, which I think is a wonderful point, that this is something that we can do, but because so many people, because there were generations before us that were actively discouraged from breastfeeding. There's a long history in America of my grandmother, who had her children in 62 and 65, she was a heavier set woman. She had very big pendulous breasts, and her doctor told her that her breasts were too big to breastfeed. So they just gave her an injection of, I don't know, was it what they gave the injection of, but I know that they used to do that, and to dry up her milk so it wouldn't, quote, come in. And, she was never even given an opportunity to try to put her babies to breast. She was just told, you can't. So this idea of human milk, saying it like that, when people are saying to you, why are you breastfeeding still? When are you going to stop breastfeeding? When are you going to give them real milk? And you're like, we mean cow's milk? Because it's not real milk. Because it's not that it's real or unreal. It's cow's milk versus human milk versus goat's milk versus rabbit milk. I mean, I don't think anybody's milking rabbits, but I'm just saying.
That reminds me of the story that in our last episode, where there's a mom that we interviewed who is nursing her child who's 5 years old. And one of the fun stories that she told was that she was at a friend's house, and the daughter was at the friend's house without the mother, and they were offering her a drink, like, do you want water? Do you want juice? What do you want? And she said, I would like human milk, please.
That's great.
And there was an explanation that needed to happen.
Like, well, we don't actually have any of that in the refrigerator.
Yeah, that's not, we don't really have that for guests.
Right. The mom was like, I stopped pumping a while ago, so I don't have any.
Oh, that's so great.
Isn't that cute?
Yeah, that was sweet.
All right, here's another good one that I hear all the time: nipple confusion. Nipple confusion. What do people mean when they say that, and what actually should we be talking about?
Well, this might get me in trouble, but I just don't think there is such a thing. Again, because our babies are mammals, I think they know what they're doing. And what people are referring to is that a lot of times when babies are struggling to breastfeed, they are given a bottle to eat. Not eat the bottle, but being fed with the bottle.
Yeah.
And then maybe the parents try a little bit later to breastfeed, and the baby can't breastfeed, and they assume it was because of that bottle, not realizing that there were struggles right at the beginning too, and that's why the bottle was given. So I've never seen a baby that didn't, quote, want to nurse, and when given the opportunity and to correct the problems that were around before, they do end up nursing. But yeah, I think that's what people are talking about. Certainly, if babies don't have the opportunity to breastfeed and they're spending a lot of time with pacifiers or bottles, if they're a little bit older, like maybe over 2 months or so, it might take a little while to help them understand what's going on there, even though their instincts are there to latch on, but they haven't had the experience. We have to give them the experience. So I think that's what people are seeing, is they're assuming that because they had a bottle, that's the reason they can't breastfeed. But the reason they had the bottle is because they were having trouble breastfeeding to begin with.
Do you feel too that I think sometimes it seems like because the bottle is often given in that traditional position where the baby's laid back and the bottle, the bottom of the bottle is towards the ceiling. And so the milk is just flowing and flowing, even if it's a quote unquote slow flow, because there's no standard for that. But that then the baby's like, well, okay, you just fed me really fast. And then they get to the breast and they have to work for it. And sometimes they may argue about that in a way.
I would even,
I don't know.
I would even say,
how would you word that?
Actually, working for it is one of those phrases that kind of bothers me, because this is a biologically normal thing. That's like saying, well, I have a CPAP machine now, so therefore I'm never going to breathe normally, like, because it's so much easier if I have somebody breathe for me. That's just not what we're going to do, because this is normal. So I think we need to give the baby the experience of the breast. And I think a lot of times when people are frustrated because their baby isn't taking the breast, then they end up being in a battle with the baby, trying and trying, and everybody's crying, right? And then the baby looks at they have this primitive brain, and they look at the breast then and go, well, that's where I cry. So, we all know that there are ways to sort of help the baby start making friends with the breast, and reminding the baby about what's going on there. And certainly we can feed a baby in a way that is helpful to that, but they have to learn that they have to suck 5 or 6 times before the milk comes. So that,
right, and
that
part of that is
thing.
teaching how to do a bottle differently so that they're used to that part. And I mean, you're going to change the way I talk now, because I have been using work for it. But you're right, if you think, because my other analogy for feeding being so biologically normal is walking. And if your child was limping, nobody would say like, oh, well, they're being lazy, they don't want to walk. They'd be like, why are they limping? Let's figure this out. And you wouldn't say go work for it. Well, they're not working hard enough to walk, right? So yeah, you're right. Like it's not the right wording.
I really don't think it is, because that implies that breastfeeding is somehow difficult. And it is not. When you of course, I don't remember the name of the study or when it was done, but I do know that when babies are eating from a bottle, the heart rate, blood pressure, other stress cues go up higher than when they're nursing. So we know that biologically it's not more work to breastfeed. Of course, if it's hard for them, it's hard for them. So we have to figure out why it's hard for them. Yesterday I got a baby who wasn't nursing to nurse quite well with a nipple shield. And the mom, of course, said, well, why does he like the nipple shield better than my breast? Which brings us to, liking. I said, no, this is working for him, because just like the bottle, there's a hard plastic shape that's in his mouth. So when his tongue doesn't quite do things correctly, it just stays there and waits. But when that happens on your breast, the breast goes away. And so, of course, he's going to cry. So that really helped her understand. And I pointed out that, you see, the nipple shield is sliding in and out of his mouth. The bottle is sliding in and out of his mouth. On your breast, that just can't work. So we have to figure that part out with his tongue.
I think it's very important for parents to understand that your baby is, like you said, very primitive. And they have to eat and want to eat. It's not that they do or do not like to eat. I've heard people say, he doesn't like my milk. right? Like he preferred, because it was, the first couple times they tried to latch in the hospital, it was challenging because it's a learning curve for everybody. Even as a nurse who had been a nurse for 7 years before, a maternity nurse for 7 years before becoming a mother, learning how to latch a baby onto my own breast was really tough. I mean, it's a learning curve. So people say, well, he must not like my milk. And it always would break my heart
Doesn't
to
it
hear
just
that
hurt?
because it hurts. It really hurts my heart because it's not that he doesn't like your milk. It's that we're learning together. You're learning together. And if somebody pours a bottle of formula in his mouth, he is going to have the reflex to swallow that, just like you would if I tipped your head back and took a glass of water and, you would have to gulp. So it's not that he likes formula and he doesn't like breast milk. He's a baby. He's biologically meant to drink breast milk. He's not like, oh, that's not the vintage that I like. No, I prefer, they're not thinking that way. So, I know people don't like the term like normal. That's why I like that we're saying biologically normal. It's not that formula is abnormal. It's that breast milk and breastfeeding is biologically normal for a human baby. And therefore it's not a judgment call on the part of this baby about your milk not being just delicious enough for him. We have to figure out a way to help him out.
I love the concept of the breastaurant.
That's
somebody who knows who coined, right? And if you were having a hard time eating in the restaurant and you were crying and screaming, then whoever you were with is not going to try to feed you right then. And I think sometimes the process of getting the baby onto the breast is so frustrating, especially when it's either a first timer who hasn't had practice doing this, or there's an issue with the baby in that moment. It may not be a tongue tie, it may not be a major issue, but there's something about that interaction between the two that the baby's not getting the breast fast enough sometimes, or the breast is far away. You always see those people where the nipple's far away and they're waiting for the baby to open their mouth and the baby's like 3 inches away and you're like, like put the baby's face on the breast. And they're like, really? Am I not hurting him? I'm like, you're not hurting him. He's not complaining. Look, he just latched on. He's very happy. It's sort of, it's thinking about, let's make this a pleasurable experience. Like you were using that word, Renee, like the experience, like when they experience breastfeeding and it goes well, and sometimes that's why when we help people with feeding, sometimes it's a very quick and easy type of thing. I joke sometimes when I go in and I just help the people, help them latch well, and they're like, oh my gosh, that's so perfect. And I go, okie dokie, my job's done here. It's like been 10 minutes, I don't really leave. Like we talk about lots of other things, practice other positions, etc. But then sometimes there's really major issues and I need to see people many times to work on those issues. Right. And so it's not just natural, quote unquote. That's another expression there. Oh, it's so natural. Right. It's learned.
Yes, it's natural, but it's also learned. There are lots of things that we do naturally, but we learn them because we're watching other people do them. We don't get to watch other people breastfeed in our culture very often. And I tell people that all the time. Like, you wouldn't just hand your 5-year-old chopsticks and say, here, go for it. You would teach them, or people learn how to use the toilet and all those other natural things because they're watching.
Yeah, and even if there weren't toilets, you'd still have to be taught how to go to the bathroom in the woods.
That's right. That's right.
So that kind of leads to another thing that I hear a lot. We're talking nipple confusion versus flow of the milk, but bottle refusal or breast refusal versus inability to latch to the breast or bottle. This is interesting because a lot of people hear, breast refusal or having trouble latching and they think breast. But can you talk about how babies can even have trouble latching to bottles?
Sure. I don't like that word refusal either. Certainly I can refuse things, but a baby cannot. He's just not. He just can't. They really can't refuse, because it is, like you said, they're very survival to latch onto something and suck, whatever that is. So, if a newborn is having trouble taking the breast and also having trouble taking the bottle, I would be very concerned. I mean, there's something going on there that the baby isn't able to, form that seal and suck and swallow, whatever that is. But an older baby who suddenly is presented with a bottle at maybe 3 or 4 months old, because parents have to go to work or whatever it is, and they're not, for whatever reason, they're not enthusiastic about taking it, or they can't. That's a whole different thing. That's like, it's a foreign object to them. They don't realize the culture that they're in, and that, hey, all the other babies do this, so why don't you? So
all the cool babies do it.
Yeah, just do it. This is what we do now.
Or they're like, I don't want that bottle. I want a different bottle.
Yeah, or whatever it is. And
yeah.
I think to me it seems really normal that they're going, oh, well, this is interesting. I can chew on it. I can play with it with my tongue. But, hey, I'd really like to breastfeed now, please. So,
I smell my mom in the vicinity.
Exactly. When I bite on this, it kind of tastes like cutie or sweetie, but
yeah, that's kind of fun and interesting. But, like you were saying earlier, Melissa, we think of the breast as a feeding method, but I don't think that's how babies think of it. I think they think of it as a more, it's a more holistic, like solving all the problems.
Yes.
Situation or whatever it is, it's going to fix it. And this bottle might be interesting to get a little milk, but it's not going to be the thing that makes them completely blissed out and all of a sudden make everything better, unless they have a lot of experience with that. And I always tell people to start a little younger, maybe after 3 or 4 weeks, if they know that they want their baby to have a bottle, so that they don't have that surprise when a baby can start making choices about what goes in their mouths at around 3 or 4 months. Then they can make choices about that, which is a wonderful thing.
Yeah. And if you think about it, it's a very smart baby to be weary of anything that is unfamiliar. So, because as cave people, we were supposed to be weary of things that were unfamiliar because it might be poisonous or kill us. So if that wasn't something that they were used to having in their mouth, then, it makes sense that they're like, hey, wait a minute, I don't know about this.
Yeah, I actually mused on my website. I have a post about this because I really felt like, I feel like breastfeeding is just the wrong word. Like you were saying, breast parenting or breast nurturing or, something like that, because breastfeeding just kind of, it removes part of it. It isolates our breast to only the function of feeding the baby. And then, of course, we think, well, why won't this baby take a bottle? Like, it just doesn't make sense. Like, this is how I'm giving the baby food. And it's just like the breast. It looks like the breast. So why not?
Kind of.
Yeah.
Well,
and
the
on
word
the flip
nursing,
side,
the word nursing is another way to put it. But I also
Yes.
have always found it interesting that we would say a baby on the breast is nursing. However, Melissa, you're a nurse and you went into the profession of nursing. Like, how did that happen?
Yeah.
right.
Are those two things related? But it's so interesting to me that those same words were chosen, and I'm sure it has something. I would hope it has something to do with like caregiving. But why aren't you a caregiver? Right? There could have been a different word, but I think in the realm of feeding and nurturing, nurse, is a nice word.
And as far as breast parenting, because I love that idea, because that's kind of how I feel like I've parented all my children. And that's not to say that you can't parent if you feed a different way. I want to make that very clear, whether it's pumped milk or it's formula. But so that's not my intention in loving that word. What I think, if we utilize that more, though, what I think would become more normalized is all the other ways, like you said, that we used the breast. So people maybe wouldn't feel that it was wrong if their baby, quote, nursed to sleep. Or,
thank you. Yes.
Right? Like nursed when they got a boo-boo, or wanted to, quote, use me as a pacifier. I'm putting all of this in scare quotes for those listening on the podcast, because for people that know about breast parenting, right, that those are all biologically normal interactions and relationships to have with breastfeeding. And when we just say breastfeeding, it makes it sound like if the baby's doing this for any other reason besides strict nutrition, then it is wrong. So you can't nurse to sleep, and you can't nurse when they have a boo-boo, and you can't nurse when they, have a nap time, and you need to be on a schedule. And that is not biologically normal for a human lactation relationship.
Yes, I think it would change things, and it would help parents do what comes naturally to them. Because I think, I know for me, I was always trying to overthink that too. Like, people actually told me, well, if your baby cries and you put them to the breast, then that's just like being in a grocery store and they want the sugar frosted flakes and you give them a cookie. Like,
Wow.
no, it is not. Like, that's what I was
Wow.
told. Like, if you reward that behavior with food, then they're going to learn that when they get upset, only food will calm them down. And I'm
Oh, wow.
like, this isn't food. This is
But
me.
also
I'm their mommy.
babies don't really have behavior. They don't have volitional behavior,
Right.
right?
Right. But I'm even talking about toddlers. So,
Sure.
toddler falls down, they run to mom, they nurse for three
True.
seconds, and then everything's better.
Mm-hmm.
And so was that a tool that I wanted to give up? Was I giving them a reward for falling down? Was I giving them a treat for crying? No.
Yeah. It's like
I
a
would
hug.
it's me. It's not my boobs, it's me.
Right.
So I think that's what I like about breast parenting, is because anyone can do it, really.
Mm,
You don't have to have milk to
right.
breast parent, right? And there are a lot of people I know, we all know people in our practices who did not make milk or not make very much milk, and they bottle fed for nutrition and put the baby to the breast for
Mm-hmm.
lots of other reasons.
Mm-hmm.
You know,
Right.
this actually is like an epiphany for me, Renee, because my daughter now is 16 months old, and
Oh.
sometimes there
I
is.
feel like she was just 9 months old.
I know, it's crazy. But so sometimes, like, she's been breastfeeding for a while, and I'm starting to get a little touched out, and my boobs feel quite drained, and so I say, no more. There's no more milk, and she looks at me like, you're crazy.
Yeah. So what?
Because it's not really about that for her. And even though for me, I'm kind of feeling like I'm done with something sucking on my nipples right now, she's like, yeah, that doesn't matter to me. I really want to
Right.
do this right now. So I gotta take a different approach.
Yeah.
Yeah, that's not working.
Right. So I wanted to take a moment in the middle of our show to ask everybody who's listening to visit babiesincommon.com/show to view all our previous episodes and share them with your family and friends. And our show is also available as a video as well as a podcast on our website, on Spotify, and Apple Podcasts. So please be sure to hit the subscribe button and to ensure that you catch all the future episodes.
That's right, Jeanette. You wouldn't want to miss a single one. And we hope you'll take this opportunity right now to pause this episode and hop over to Babies in Common's Facebook page or Google listing, or even your podcast app to write a positive review for us today to help us reach more families. And lastly, please visit our website or social media channels to learn more about the groups, classes, and other services we offer, as well as plenty of tips and resources to help you rock your birth and thrive as a new parent. Okay, back to our show. What's next?
All right. So my biggest pet peeve, revision versus release for a tongue tie.
Thank you.
Tell me what you think.
Makes it, well, gosh, revision.
And you've been working in the world of tongue tie releases, frenotomies, phrenectomy, all the different words for it. You've been doing this for 20 years, right?
29.
Oh gosh. Wow. Okay. So has the lingo changed? Like,
yeah, nobody used to say revise.
yeah, I revised my baby.
Back in the day, like you
revise a
your
paper.
Baby?
You revise a paper.
You turned the baby into a what? It implies that the frenotomy has been done already, and then you had to somehow fix it, which is not correct. We used to say, we just used to say frenotomy, and back in the day, and that's, or clip the frenulum, because where I was, it was always scissors. I think pretty much everybody was doing scissors then. I don't know that laser was being used at that time. I sound like I'm really ancient, but
feels like yesterday.
Yeah. If we say release, I like that word, because it's just like, free the tongue.
Yes.
Right.
It just sounds,
and it helps the parents understand.
And it doesn't sound so scary. And I've had little mini debates on Facebook with people who are like, it doesn't seem scary. I don't mind the word revision, so stop telling me. I know what you mean. And I'm like, okay, well, I don't know, but I do work with families that are really nervous about this procedure.
Mm-hmm.
And when you say, I feel like, to me, the word release sounds much more freeing and much less involved than even the word procedure. But
Right.
like a revision sounds so intense. But isn't it so interesting word-wise that, you know, if your friend has a hysterectomy, that's a word we use all the time, is hysterectomy. You don't say, my friend had her uterus removed.
Or revised.
Right? And
she had her womb revised.
But at the same time, right, if someone has a nose job, we call it a nose job. We don't call it rhinoplasty
Right.
when we're talking about it. So isn't it weird that we have certain words that we
Yes.
use the medical term? And sure, if someone said they're having a frenotomy or frenectomy, and that is based on the way they're doing the release, whether it's scissors or laser, right? But just having a release, I think, I implore, that's I don't know. So you would agree? Release is a better word.
Me too. Oh, totally. And I like, the other thing I like about release is because it's very clear that there is something that is stuck, that is not moving correctly. And we're going to allow it to move correctly now. And, you know, people will ask me, will this ever impact the baby's speech? Like thinking that this procedure is going to do some kind of harm. And I said,
or reconstruction of the tongue or face in some way. Yeah.
And I'm like, what it's going to do is allow the baby to move their tongue normally. So that's what we want. We want the baby to be able to move their tongue. And
like, imagine if you were born with your thumb attached to your hand with a membrane, or all your fingers were fused together, right? Nobody would look at that and say, you know, we should leave that way.
We better leave it that way. You know, I use that exact example.
Do you? Oh, wow.
Yes. And I actually said something to somebody. I said, what if your pinky was constantly bent when you were born? And you said, well, you know, she can still eat, she can still play. She just won't be able to play the piano very well. So we're just going to leave it like that.
Right.
And then the parents kind of have this, oh, yeah. So yeah, I use release too, or I'll talk about, this seems really, there's a lot of tension under here. I think it would really help to get that tension released.
Right.
And love it. Thank you for bringing that up.
Yeah, there's also the concept where some people will say, well, my baby's doctor said that the baby's gaining weight, so then it's not a tongue tie, or the baby's tongue will stick out of their mouth a little bit.
Right.
And so that's not a tongue tie. And I'm like, okay, let's pack up to the walking. If nursing or feeding at the breast as well, if those are things or even just suckling on a bottle effectively, really, if that can't happen, that's a biological normal thing. We want that to happen. And so we want to investigate that. Just like if a baby was supposed to biologically walk, we expect that of humans, that if your baby was limping all the time, your baby's doctor would never, ever say, that's okay, they still get places. It's cool. They can just limp. Or
they gotta
they fall
drag
a lot.
that gimpy leg, but they can get there. So.
But that being said, we also have to acknowledge that there are some babies who never will suckle, and sometimes not even on a bottle. Like they have other things going on, and they just won't. And there are some kids that no matter what intervention, surgery, physical therapy, or whatever we do, they're going to need a wheelchair for the rest of their life. So we understand there's those outliers, but you would never just go, meh, we'll just leave it alone and never look into it. So we always want to investigate that, because if a baby can't breastfeed, and sometimes I've seen babies who can't bottle feed because of a tongue tie too, but it's kind of a mix of things.
Yeah.
But I've definitely more seen babies who love to breastfeed, but they don't want to use the bottle. And again, I accidentally said it. They can't figure out how to use the bottle. Yeah.
Well, you know, the way I like to explain it to parents is it's kind of interesting how right out of the gate, a baby has to do this really complicated behavior, right? So not only are they learning how to breathe, but they also have to learn how to suck, swallow, and breathe. And swallowing is super complicated. And then we have this little tiny tissue under the tongue that can cause major problems. And so, you know, it's almost like there's this litmus test, like, okay, yeah, breastfeeding's complicated. You know, there's a lot going on. There's a lot of moving parts. Moving the tongue is complicated. Swallowing is complicated. So if there's something going on there, then it's something we need to address, not just, well, we're muddling through, but it should be enjoyable and relatively easy for all involved and not hurt.
When
Yeah.
parents say things to me as a nurse, like, well, I heard that that's controversial when it comes to, if I bring up the release of of a restriction in the mouth, my go-to phrase is the following. I say, for people that actually understand human lactation and the anatomy of an infant's mouth, it is not controversial. I just like leave it at
I
that.
love
Like, there's
that.
no controversy in people who actually understand how
I
the mouth
love
is
that.
supposed to work.
Yeah,
Because you can make anything a controversy, right? If you have people on one side that have no idea what they're talking about, who have had no training in that whatsoever. And we've talked in many podcasts about the lack of training that pediatricians and maternity nurses and certainly OBGYNs have in, like, the lack of training they have in infant feeding in general, especially breastfeeding. So
right, it's not their expertise. And
Yeah.
and that's totally fine with me as long as they say, hey, go to this person, that's their
Exactly.
expertise.
Mm-hmm.
And thankfully more and more people are doing that now. So
yes.
kudos to them, because we all
All right, my
need
turn.
need to know our
Yes.
limits.
I got my pet peeve, lazy baby.
Oh,
Right? Why
yeah.
are we being so critical of babies that have just gone through this arduous journey of birth? I mean, wouldn't you be tired after being squeezed out of a vagina or an abdominal cavity? I feel like lazy baby is so negative. So can you talk a little bit about that term and what people might mean by that and what's a better way to describe it?
It's awful. I hate it. I hate giving babies adult attributes. Like they're lazy, they're mad, they don't like me. Look,
Yeah.
they're pushing me away. We're talking about a 5-day-old baby here. They don't have those kinds of things going on in their brains. They're just not that sophisticated. And no, they are not lazy. My gosh. Yeah. Today I'm feeling too lazy to swallow, or I'm too lazy to breathe. Like that. And when we bring it down to that, like, eating is survival. So we can't be too lazy to eat. If we're having trouble with eating, then we're having trouble.
Right.
So that's why I think these words are so important, because it helps not only the parents, but also the professionals look at the babies in a different way. And instead of giving them some kind of character flaw, they're saying, why is this baby sleeping all the time? Why am I having such a hard time waking up this baby? Or the baby gets on the breast and then just doesn't seem to do anything. Well, what's going on?
Right.
Instead of, well, that's just how he is. His dad's like that too. Don't you hear that though? He's just like his father. He's so lazy. He lays on the couch and watches TV. He doesn't even care.
I hear that from a lot of nurses too. Again, I'm not trying to throw my profession under the bus by any means, but I hear, even like in labor and delivery, we'll hear, oh, your baby's misbehaving if they've moved away from the monitor, right? We hear that, like, oh, your baby's misbehaving, or tell that baby they better behave. And I think that you're trying to make a joke.
Trying to be cute, right?
Right. And I get that, but not all parents take it that way, right? Like, I'm sure you guys find this. I know it's been written about in lactation literature, but that, how sensitive the new parent brain is to information, and how literally people take things that we say. And one story that I tell is, there was a mother who came in for a pediatric appointment, and the baby was like 6 months old, and it was a 95-degree day outside, and the baby was wearing a wool cap. And the nurse said, oh, you don't have to, the baby doesn't have to wear a hat anymore. It's very, very warm out. The baby, just want to dress maybe one light layer more than what you wear. And she was like, oh, because in the NICU, they told me the baby always has to wear a hat, always has to wear a hat. And like, people hearing this might be like, oh my God, how stupid can you be? Of course. But no, it's not stupidity. It's not ignorance. It's imprinting in a very new parent brain, where you are sleep deprived and you are in pain, and you are, your baby, especially in a NICU situation, has been ripped away from you. Right. Yes. And you're going to take everything that those people say literally. So if they say that, you have to feed the baby every 15 minutes on each side, they're going to feed 15 minutes on each side. If you say that baby has to always wear a hat, that baby's always going to wear a hat. And so as healthcare professionals, we need to remember that our words really matter. And so when we say something like lazy baby, right, instead of wow, let's figure out why your baby is falling asleep at the breast. Is it
Yes.
a flow? Is it a latch issue? Is it a blood sugar issue? Is it a, something, right? Like what's going on? Let's, because parents are listening, they hear what we're saying, and sometimes they do take it literally when we don't think, oh, they would never take that literally, but they do.
Yeah, absolutely. And I think especially when you have a preemie situation or a NICU situation where they really are so dependent on everything that the healthcare provider is telling them, and they want to do everything just right.
Yes.
And they're scared.
Absolutely.
So that's what they do.
Or maybe they're not even scared anymore because maybe they didn't have a NICU situation or a scary situation, but they can just be really passionate about wanting to do everything quote unquote right.
Right. Put a lot of pressure on themselves to do it.
And I think it goes on a spectrum too. I think there are parents who also feel like there's a little too much direction and they're like, we'll be fine, right? And a lot of times they are fine, This is a little human, and if you're making enough milk and you're feeding them often enough, you might just do great. But there are those outliers where, you have to be very much more direct and like your baby needs to eat. Your baby's not gaining well enough.
Right.
And then there's other times where you're like, they're nervous, but everything is going great. And it's just reassuring them that, no, that's normal. Oh, that's totally normal too. Oh, your baby falls asleep on the breast and they're gaining well. That's awesome. And like, it is, so it's so interesting, just the spectrum of different types of listeners and people who have heard one thing or not the other. It's fascinating. Words matter.
True. I hear a lot of barracuda baby coming from hospitals as well. Like the nurse told me my baby was a barracuda.
Oh my gosh.
And that's why this person's nipples are so sore. And that's just the way it is, because again, this baby was labeled. So it's something, there's obviously, this is just what my baby does, not, oh, my nipples are sore. How do we fix this?
Right.
But my baby is a barracuda, or my baby is a biter, or my baby is a chomper. All those kinds of words, I think, were just, I can't even imagine how difficult it is for them to go through those first couple of weeks or so, having those words, thinking about their baby in that way.
Right. I don't want to nurse a barracuda.
No.
I'm going to be honest with you. That thought in my brain
no way.
It's not something I want latched onto my nipple. So, if someone's kind of having a hard time, I can see that being like the straw that breaks the camel's back. Well, if this is how he is, I'm not doing 6 months of this, and then just give up. Right.
And related to that, sometimes the babies that might be given that label, sometimes it's also said, well, they told me that the baby had a short tongue. When actually, well, there's a membrane holding back that tongue, and that's why the tongue appears short.
Right.
And that's why it feels like biting.
Yes.
Yep.
Because they're trying. The babies are smart, and they're trying to compensate. Their tongue won't do what it needs to do.
Holding on.
Or sometimes they have a beautiful tongue, but their jaw is so tight from how they were in utero or the process of birth that we just need to work on their jaw, and maybe even just getting more breast into the mouth will help with that.
Or maybe the baby's nose is pressed up against the breast, and that makes the tongue pull back. We have so much wisdom here.
I know. I'm just thinking, like, I hope that people listening are like, wow, everybody should just have an IBCLC visit after they have a baby. I mean, it would, at home, like not just at the hospital, because those IBCLCs are often under, they have a big patient list that they have to get to. So they might not be able to spend the time that at a private practice IBCLC in your own home, at your own pace.
Although it's a pandemic, so maybe not in your own home.
Well, maybe, virtual too.
We're good at that. Yeah, I think that's the thing. Like when you were talking about the 15 minutes on each side, Melissa, I think I like to give people, the professionals, the benefit of the doubt, in that what they may be saying or trying to say is, usually babies breastfeed for about this amount of time, because I know my clients ask me, how long should the baby stay on each breast? How long total? They want that. They really want to know. And they don't get that from me. So I'm really annoying. And I say, well, this is what you're going to do. And it's more or less like this. And we're going to watch the baby. But they want those numbers. So if you have 5 minutes to spend with a family and they ask you that question, you're not going to be able to sit down and explain the whole process. So you might say about 15 minutes on each side or so.
Right.
And then that's the truth. That's what they do.
Yeah. Do you have
Hard.
any other words, Renee,
I
that
have
you wanted to talk
I
about?
have so many words, but I wasn't quite sure how long we were going here. Cluster feeding. That's another one. And, that's a term that is misused a lot, I've found. Have you found that, Jeanette? Where people are describing a baby who is really, really hungry and not getting enough to eat and at the breast constantly because they're never satisfied because there's might be a low milk supply problem. And people, I'm seeing this a lot among parents talking about, oh yeah, my baby has been cluster feeding for 3 days, meaning all day long, all the time, where this term was developed to talk about what La Leche League used to call frequency days, where an otherwise normal, just fine nursing relationship, everything's going great, where there might be a few hours for a couple of days where the baby nurses more frequently. That is kind of what I think of as cluster feeding, but it's being used differently. And I think it's important that I don't know how to address it, but just make sure that to ask what that means to that person.
Yeah.
And to maybe start saying, gosh, why is my baby nursing like every half hour, 24/7 on the breast? Never kind of gives me that milk drunk look. Never seems satisfied. Maybe I should go make sure baby's gaining well. Maybe I should see a lactation consultant just to make sure things are going okay. Because to me, that seems like there might be something going on that isn't normal.
Well, they're also being told often, so often I'm finding people are being told that they're supposed to feed their baby every 3 hours.
Right.
Right, which is more of a phrase versus words, but it's the words being used every 3 hours. And so I've been having a conversation recently with one client who was saying, well, when is my 5-pound baby going to be ready to go for 3 hours?
Oh.
And I was like, not for a long time and maybe never. But also, like, there are 6-month-olds that don't go 3 hours,
Right.
Like, that can be normal, but especially when your baby's little, we're not trying to get them to go 3 hours. We need them to really grow. And we have to do that frequently. But and then I think there's some people still who are like, well, they said every 3 hours, so it's not time yet. So I'm sorry the baby's crying. I'm going to do all sorts of other things to try to calm my baby because it's not time to eat yet.
Right. Oh, yes. Yeah. We won't mention any programs by name. But yes, that is happening a lot in my area. It's not nap time yet, or it's not time to eat yet.
Not okay. Not okay.
Nope. Do go a lot better when we sort of follow the baby's lead.
Yes. Always watch the baby. For sure.
I did hear the other day from a client that the baby wasn't. How did she put it? The baby's not performing. That's what it was.
Oh wow!
Yeah.
Ouch.
Yeah. Baby's not performing, meaning that I guess they weren't feeling like latching on at that moment or something. And I don't know. It's just really interesting what we say.
Yeah. Any other words before we wrap up that you want to add to the list?
Yeah, a doula in my community recently told me that this baby isn't having any feeding problems. It was a mutual client. He just doesn't like to sleep. So I don't know anybody who doesn't like to sleep.
Again, a biological normal thing you're supposed to do.
Yeah. And all these like liking or not liking my breast, you mentioned that. No, I think we covered a lot of things. There's always more. But maybe I'm sure we can come up with a lot more if we kept talking.
Right. Well, maybe we will do that. Well, thank you so much for coming on our show. And I certainly hope that this conversation has inspired some changes in the parental lexicon with this deep discussion of different words. And for our listeners, if you can think of any other words or phrases that you wish were changed, please let us know by emailing info@babiesincommon.com, or you can just comment on our Facebook or Instagram post for this episode number 38. We
hope you have. all enjoyed today's show. We hope you will tune in again. Remember, Babies in Common is a community for you. After all, we all have
babies in common. Awesome. Thank you, Renee.
Thank you. It was
Renee.
fun.